Number one, we don't know all the ramifications of what's going to happen, and the governor said that he's not, at least what I took away from it, he's not necessarily leaning towards Medicaid expansion now, that we need to look at that, even though we have the opportunity to do it now. There's a lot of argument that if we expand Medicaid, we can get rid of some of the catastrophic costs. The indigent fund in the county could become a source of revenue for counties, because we probably wouldn't need nearly as much or maybe any of that anymore. There's a lot of arguments pro and con. I don't know what's going to happen. Obviously, there's a lot of ambition to try to temper the law or change the law or repeal the law or whatever, and so there's some things going on that we just don't know where it's going to lead us. The reality is Idaho's going to have to deal with the problem of health care delivery just like every other state. It's a major, major problem, and when we are spending so much on our health care, whether it be through indigency or Medicaid, we're compromising what we can spend on schools or roads or everything else. So it's not something we can just turn our head and pretend it doesn't exist. We have a population that's dependent upon that, and we can argue all day long about whether it's there's fraud or whether there's people getting benefits that don't deserve it, and certainly that's something that I think they continue to try to monitor and track. But it's a reality that's not we can't just bury our head in the sand either. So as far as what's going to happen with Medicaid down the road, certainly there's a push by Obamacare to get more people eligible and qualified for Medicaid. The reality is we're paying for a lot of those folks now through, as I mentioned, county indigency and things like that. So, and again, if it was an easy problem to answer, we'd have the answers, and that's why we have a lot of discussion, a lot of disagreement as far as difference of opinion, and it'll continue to have.